Welcome to Webinar Wednesday with Palmetto Care Connections. I'm your host, Davia Smith, Director of Education at PCC. Today, Kimberly South, Community Health Manager at Prisma Health, has joined us to share some information about their school-based telehealth program. Before the presentation, I'd like to announce this webinar is being recorded. The webinar recording and presentation slides will be available after the webinar. I would like to introduce our speaker for the hour. Kimberly South is a Community Health Program Manager at Prisma Health and works in Community Health Improvement Office at the Baptist Campus in Columbia. She manages school-based telehealth programs in the Midlands and oversees clinical and education initiatives in several Midlands school districts. She also manages more than a dozen community organization partnerships and focuses on ROI, increased access to care, and medical home referrals. Kimberly assists with several Prisma Health events, including WellFest, flu shot clinics, COVID-19 testing, and vaccination efforts. Her background is in media, public relations, marketing, communication, and community health programming. She has an undergraduate degree from the University of North Carolina and a Master's of Communications degree from the University of South Carolina. At this time, I'd like to turn our portion of the webinar over to our speaker, Kimberly South. Kimberly, thank you so much for joining us today.
Hi, good morning, Davia. Thank you so much for having me. I'm excited to be here this Wednesday morning and honored to be part of the program for your Wednesday webinar by Palmetto Care Connections. As Davia said, I work with Prisma Health and I've been here for nearly 10 years and come from a background of marketing and have worked closely with our healthcare partners and have really enjoyed this role that I'm in now as a community health program manager in the Office of Community Health. So a lot of you, there's songs out there that remind me of COVID-19, you know, where were you, what were you doing? What were you doing in March of 2020? I know for Prisma Health and where I was, I remember we were putting together our big WellFest event, and all of a sudden we had to cancel it and really pivot and change everything. Our world turned over. I would imagine that most of you on this call today have that same sense of where was I? What were you doing at that moment? And now looking back, it seems like a lifetime ago, but our world really has changed. So telehealth and virtual health is becoming a common word around household and physician offices during this pandemic. But even before COVID-19, telehealth and virtual health programs were operational throughout our state, including many schools. In fact, in 2016, Prisma Health began offering clinical and education services through telehealth in several of our Midlands school districts through high-tech nursing carts and live stream TV systems. Students, teachers, and parents benefited from all of this increased access to care and healthy lifestyle awareness. Then in early 2020, the COVID-19 pandemic created a major shift in how our programs and services were delivered. So this presentation will be a pause and pivot approach to what our landscape is. A then and now look, what changed and why. What we'll look at a then and now snapshot, why we had to shift our focus, how we had to pivot, and then the next chapter, where do we go from here? So then and now, our world felt normal, and then it didn't. We paused. What is our new normal? These illustrations in front of you, you guys could probably really relate with what is going on. I think now we have a mix of both what's on your left and right, but I would imagine that a lot of you are very familiar with the right side of the screen with masking, staying at home, and working what it feels like all by yourself. But now I feel like we are moving into some sort of new normal. Many of us are comfortable with a moment's notice shift. Should we be comfortable with that? These are questions we should consider as we settle back into our new normal and assess what is important to us. So what does school-based health mean to you? Some of you may provide it already. Some of you may be considering providing it. Prisma Health partners with school districts to provide virtual healthcare programs, offering students and parents a way to receive clinical and education services through digital health solutions in our schools. Throughout the state, we have school health centers embedded in schools. We have virtual healthcare visits through devices. We have health education delivered through technology, and a variety of online health-based activities for students and educators. We even brought along a new service platform recently for our online health activities called Go Noodle. We'll have more on that in a few minutes. But keep in mind, virtual health services in the schools are not intended to replace primary care providers. What we're doing is adding access to care. This is an ultimate goal for all of us, and our providers can help guide parents and guardians if needed to the appropriate primary care and pediatric services. All of our students are encouraged to follow up with the provider. Let's look at the benefits that these programs offer us. Many educators and school administrators are looking into strategies to decrease absenteeism and missed seat instruction time. We monitor that and we look at how these programs can help. Virtual healthcare in our schools are a way to keep students with non-emergent needs in the classroom, not sitting in urgent care or emergency room waiting rooms. Many students only have this option of emergency rooms if they don't have a primary care provider. Telehealth and virtual health programs help to eliminate that. Before COVID-19, we were mitigating minor ailments such as coughing, runny nose, earaches. The nurse practitioner would diagnose these through virtual health visits and provide prescriptions if needed for parents and guardians to pick these up. That allows for quicker recovery, reduction of parents' missed work days. Many of our parents work more than 30 minutes from their student's school, especially in our lower Richland County areas. This missed time from work, plus possible wait times in urgent care, could be a huge barrier to getting the right type of care. Prisma Health does file insurance and bill Medicaid for these visits, but virtual telehealth visits are at no cost to parents and guardians. Potential cost savings through unnecessary ER visits is a great benefit to our parents and healthcare systems. The education program is based off CDC and evidence-based curriculums to prevent childhood obesity. These programs should start as early as possible. We do start them as early as our second grade, and even some of our pre-K students can benefit from these programs. I want to focus on a few of our outcomes. I put a star here because I do want to focus that these numbers that are represented here are for our Midland school districts only. We do have programs in our upstate, in our Greenville County school districts, and I'll talk about that in just a second. But I do want to just mention that the numbers that you see here do reflect Richland, Lexington, and Sumter counties, our Midlands area. So before COVID, what we were measuring was our improved access to care and patient and physician satisfaction. These were done through our consents that we would send out and receive, and also through follow-up calls that we would have with parents and providers about how they felt the telehealth experience went. I want you to look at this number, the 1,835 students enrolled in Richland, Lexington, and Sumter counties. That's going to be very important here in a few minutes as we look at post-COVID outcomes. And this is in our clinical environment. We had 1,800 students enrolled and ready to be seen through telehealth programs. We also measured cost reduction for unnecessary ED and urgent care visits. We based this on a $1,300 per emergency room visit. We had 36 visits before COVID, and this was about average. And remember, in March of 2020, our schools closed their doors to students, and we did not have students in the classrooms. So 36 visits leading up to that was a very good indication of where we should have been. We would average about 35 to 40 visits per year. This for 2019 was a $46,800 estimated savings. We also had increased knowledge of healthy behaviors and activities. We measure that through self-reporting weight measures, added physical activity minutes, water usage, and healthy eating. Again, remember this number, 266 enrolled students. That's going to be an important number for us to review as we look at post-COVID and how we shifted and how we pivoted. We were able to increase physical activity by at least 10 minutes per week. As I mentioned, we do have Greenville County represented in our telehealth, our virtual health programs. The blue counties are our primary service footprint for Prisma Health, and you can see that we currently have Greenville County School District with 7 schools providing virtual and in-person school-based care. We have Lexington 1 providing virtual health care, Lexington 4 with virtual health care, and then in Richland 1, we have virtual health care in 5 of our schools. We have healthcare education in a live stream delivery in 4 of our schools. And then we have on-demand education available to all 28 elementary schools in Richland County. We are looking ahead to expand our coverage and our reach. But right now, these are our schools. This is our current landscape. So we have only to pause and pivot at this point. We're looking at what is available now and what will be available to us in the future. Pivoting made us redefine what we do and why we did it. Empty schools made us completely review how our virtual health programs operated. Without students coming to the nurses for non-emergent and non-COVID care, how can we support our nurses? How can we support our district healthcare needs? What do we have in our schools? What do students have that can be used to increase access to care? These are things like laptops and tablets and how to engage nurse support. Our outcomes shifted. Why did we have to change? So some pictures of our landscape for clinical and education before the pandemic. These pictures always make me chuckle because now we're so used to seeing people with masks. Whenever you see students and nurses and healthcare workers in pictures without masks, you know for sure that was a pre-pandemic environment. So you can see on the left with the nurse and the student, they are using the nursing carts where they are tethered to that cart and in the nurse's office. These still were state of the art and still are considered state of the art. We will show you how much we have changed though in our post-pandemic environment. These carts were purchased through a 2016 USDA Rural Health Grant, and some were leased from the South Carolina Telehealth Alliance. We also had large widescreen monitors for students in after-school programs. You can see the students looking at the monitor, receiving the instruction. And again, I always chuckle because it's odd to see students without masks on these days. So again, just a closer look at what that cart was. This is an actual photo from our Sumter County providers who were using the virtual health, telehealth carts in the Sumter School District. We provided, it was a wired network connection through the school and software provided through platforms such as American Well and Video. These visits were mostly coughing for coughs, sniffles, allergies, earaches, stomach aches. We did have some skin-related visits and even some non-emergency injuries from school activities. And this is a closer look at our education, how we provided that traditional live stream education. The photo that you're looking at is one of our South Carolina DHEC providers with a nutrition activity for the students. This was great because it allowed for good interaction between Prisma Health and with the students. You can see them closely following along to what was happening. For our programming, we do have 6 monitors. These are less mobile. They do have units attached to them that allow for live streaming, and these were available for those after-school programs. We typically had about 20 students in each of the classes, And again, that total of 266 enrolled students. Our office was the hub for education sessions. They were highly interactive, and but the content was limited to where the monitors were. So here we are, post-pandemic, in the pivot. You'll see for clinical, this is a quick look at what the Tyto device looks like. This is our new stage of normal. We now have, at times, crowded isolation rooms at schools, sometimes more paperwork for nurses, less treatment of conditions that could have been treated previously, and increased protocols for COVID-related symptoms. We were all in transition. Prisma Health began installing new devices through TytoCare that were more mobile and user-friendly to encourage nurses to use them. These devices, the TytoCare, you can actually find in Best Buy and other commercial retailers. You would connect with a regional or national physician for that care. But this includes an iPad with a device that controls peripherals that look at skin, ears, throat, record heart and lung activity. We went from that big rolling cart to a small backpack of equipment using wireless and Bluetooth technology. We're excited to have these devices, but knew the challenge was that nurses were not seeing as many students. So we began to shift our focus and strategize on how we get enrollments, something we could control. With all of our new process and equipment, that 1,800 student count that we had went to zero. We had to start from the ground up. We had to start at step one, which was getting enrollment into the program. So we went from 1,800 plus to zero at the beginning of our 2020 to 2021 school year. We also began to put education programs into the hands of students and teachers through our on-demand videos. PE and health teachers began using these videos to supplement our virtual instruction. Engagement was measured through online tests and quizzes. Students were given Prisma Health notebooks to record activities and were surprised with the jump ropes at the end if they completed their quiz assignments. We had a big change in the way that this was delivered. All right, I'm going to test our technology and see if it will work here. I'm going to pull up our link. This is what we used for all of our students and teachers. They had a page they could go to that had all of the lessons with curriculum, with words and terms to use. The quizzes were on here, along with the physical activity of Go Noodle that they could use. We're going to watch a quick video so you guys can see what this on-demand new form of education content looks like.
Hi everyone, it's Madeline from Prisma Health.
And I'm Maddie. Today we're talking about how we can make our health journey part of all that we do and include our friends and family.
Remember, we're all in this together.
And let's get out our activity journals so we can start making a list of the healthy things that we could do as a family. Madeline, what are some ideas that you have?
Well, let's start with cooking a meal together, planning weekly meals. This helps avoid quick fast food meals, packing lunches together, and even picnics together. You could always have a picnic in your own backyard.
Those are good ideas. I wrote down walking, board games, playing a healthy food scavenger hunt, creating bedtime routines together, going outside to play, reading books, putting together puzzles, and watching things like Go Noodle together.
Yes, those are ways to involve your family and friends. Great thinking, Maddie.
Thank you. Do you know why it's important to be in this health journey together? When someone else knows about our healthy behaviors, they're more likely to ask us about it. They may notice we're in a better mood or that something about us has changed for the best.
This is also called accountability. Just like your parents want you to do well in school, they also want you to be healthy. Having a family member or friend who keeps you accountable helps you stay on task with healthy behaviors.
Just like if I really wanted to go to a fast food restaurant tonight, maybe my parents would remind me that we already prepared a meal a few days ago and this just needed to be reheated. That is probably going to be a lot healthier than a quick burger and fries. And sometimes the right food is going to help us sleep better and have more energy to focus better.
Right. And there may be times we don't always make the healthiest choice, but with support from our family and friends, we can get back on track.
So kids, we want you to do something for your parents or a friend or sibling. We've sent you a letter that you can fill in for your parents.
You can print this out or just write it down in your activity journal. Just make sure you let your parents see it. Fill it in and put 3 things you will commit to do with your family to start your health journey.
I think I'm going to fill something like this out and give it to my roommate.
I think I'll do the same and give it to a coworker. Okay, so we have just one more video lesson left. Next week, we'll wrap up our time together and give you a preview of what we'll be doing when we return.
We will also give you the final quiz. If you need to go back and do your other quizzes, they should all be in your email or sent by your teacher.
And don't forget about our Doodle League. Maybe ask a friend to do it with you.
So remember, we really are all in this together. Bye, everyone. See you soon.
Bye.
All right, so I know that was a quick rendition of what our videos look like. Again, we have 13 lessons that we shared. The second half of our videos really focused on nutrition, and we're featuring our DHAC SNAP Ed educators. We had great participation. I will show you those outcomes in just a moment. So our clinical services outcomes, and again, remember this is for our Midland School District. We had a lot more visits if you would calculate our upstate school districts, but I do want to focus right now on our Midlands. In 2020 to 2021, which was our last school year, which was kind of our first school year outside of, well, within the pandemic, but once students started to come into schools, there was a lot of hybrid, there was a lot of virtual environments and in person. So we were still in a state of flux and transition. We did have 30 visits, which if you remember, before COVID, we had 36. So having 30 visits, even when we were in a transition, was a great success for us. Most of those visits included students who had a skin problem or maybe just one symptom of an earache or a headache. And then students who came in after they already tested negative for COVID, but still had additional symptoms that needed to be checked out by a nurse. We had 118 enrollments. I know that seems like a low number, but remember, we had to start from square one, where we had 0 enrollments at the beginning of the year. So having 118, and now I can tell you we have more than 400 currently where we're at in 2022. So we are increasing, and we have focused on those consents and enrollments. We are excited that students and nurses and parents are being aware of the programs available in their schools. We're only in 3 school districts. Again, we have more in the upstate. We are looking at expanding into other districts and including even more counties. But right now we're focused on the 3 school districts that were mentioned earlier. Those 30 visits equate into a $39,000 ED cost avoidance. And also, if telehealth, virtual health programs were not utilized, there could have been 104 potential school hours missed. So that's a big number for our educators. Again, they want to make sure that students are receiving the quality education and learning and staying in school as much as possible. Of course, if students are sick or can't be at school, they do understand that, but having telehealth in the schools that we are in allow for a decrease of absenteeism. And this again is what really excites me about how we pivoted during this time. You'll notice that the enrollments went to 817. That's a 74% increase in what we saw previously. That was because, again, we put this into the hands of PE teachers for students and families, and the enrollment and the awareness of healthy living and healthy behaviors, nutrition and physical activity, all had a bigger reach because of the way we were delivering. We had 75% student engagement, which was measured by the number of students interacting with the quizzes and tests. Every student who took the quiz received that Prisma Health jump rope. We got great feedback from our teachers who said that the students really enjoyed receiving the prizes, and that they were more aware of even what Prisma Health was, and that when they went by, they said, oh, that's where my telehealth education comes from. So again, awareness and engagement was a big success for us. And for both knowledge and behavior measures, students increased in both. They performed better in the post-test and responded more positive about healthy behaviors, such as drinking water and whole grain food intakes. They also acknowledged that eating breakfast more often and more than one type of fruit and vegetable, that they were doing that they were eating healthier than they were before. So how did we pivot? Here's a summary of what we did. Again, we focused on that enrollment, the sending and receiving of consent forms, registration into our EMR and to the TIDO platform. We absolutely had to have that teacher and district support from the top down. We had to upgrade equipment, we had to provide training, and we even provided some of our schools with some PPE, and eventually where we are now, we're doing some COVID testing in our Richland 1 school districts. We increased that reach, serving more students, parents, teachers, and educators through the education programs. So where do we go from here? A look ahead at our next chapter. What's changed? In our clinical world, we have more mobile virtual care options. Even though the TIDO care can be used at school, it also can be used in the home. We're not currently providing in-home nursing care, but if our world should change again, and we do need to provide care to especially some of the rural areas that we are in, we can use these devices. They're not tethered to the nurse's offices anymore. This equipment provides more user-friendly options. It also is a overall lower cost to health systems. Even though there is a cost associated with these devices and through the networking, it's a lower cost due to it's not a bulky nursing cart. The technology, when it changes, it can be easily upgraded. And insurance does cover most of the telehealth visits with a $0 copay for school visits. I don't believe that we've had any parent that has had a charge to their for any of the visits, and currently telehealth is being covered by most insurances. For education, we have increased reach, which again is that access for all schools across multiple counties and districts. We are continuing the traditional live stream delivery. We wanted to keep this because of the interaction. We knew that with the on-demand, we lost that way to interact with our students, to see their happy faces, their smiles, and to say hello to them. So right now, with students back in the schools, we are delivering care through our after-school programs that have the carts, and we do provide the education to those. And usability, we have a turnkey approach with downloadable lessons and that added component of GoNoodle. So GoNoodle, if you guys have not, if you don't know what this is, I encourage you to go to gonoodle.com. Their platform is to gather momentum from online platforms, encouraging activity and healthy behaviors. We have a contract with GoNoodle in Richland, Lexington, Sumter, and Greenville counties, available to all families and schools. Outside of those counties, there is free and public content that is available, but for those counties mentioned, you have a way to log in if you're an educator or even just a family, a resident in those counties, to log in and get specific content for either a classroom or a program that you may manage, or for your family. This is a great Friday night family activity. There's an app that you can download to a Roku device, to mobile devices, and great fun and lots of content to choose from. We have hundreds of schools within our 4 counties that are utilizing this, thousands of teachers, and hundreds of thousands of minutes that our students are actively using. This is a program across the world and has more than 12 million kids a month using this through videos, activities, and games. It is used 95% of our U.S. public elementary schools. So it's a great platform. I encourage you guys, if you're in the Richland, Lexington, Greenville, Sumter counties, to log into GoNoodle, create an account, and use it as often as you can. So creating a program like this for your areas. Who do you want on your team? How do you begin to plan? School support is key. You have to start from, again, the top down with your superintendent, district leaders, principals, all the way down to the entire school needs to be aware of the programs that you would want to provide. Health support, again, a top-down approach. We cannot do this without Prisma Health senior leadership, our digital health and virtual health departments across our system, without our nurse practitioners, our medical experts and clinical physicians, coordinators, and managers. And then what it really comes down to is the external support. So having parents, students, community groups, childcare facilities, all aware of the programs that are offered and how to access these. So what could change our path? Where we are now feels pretty good. We have, telehealth programs across our state looking to expand to more, but we also have disruptors. So we have commercial services that are there, wearable technology. Now you can use a watch to access your doctor or a physician. We have homeschool that has increased. All of these can be a good thing as long as we are focused on accessing care, the access to care, and providing the appropriate care needed. Broadband access, as we know, is a challenge for some of our rural areas. Where we don't have it, programs cannot be provided. In some of our schools, we actually have to install a hotspot because the Wi-Fi or the wireless is not 100% available. And even through the data and the cell phones, there's not always great access for all of our schools. Resources and availability. At any time, this can change. You have to have enough medical providers to provide that content and to provide the care that is needed. And of course, funding and insurance. These can change the path. Fortunately, Prisma Health has the funding, and we started out with a grant to provide this equipment. But to move forward and to sustain, we always have to be focused on how funding and insurance can change our path. What's ultimately at our finish line, again, is the ease of care, the access to care for our students in order to make a healthy community. So that is my presentation, and I hope you have enjoyed it. I know that we've covered a lot, and I know that there's been a lot of shift for all of us, and we should all give ourselves a pat on the back for being able to get to a point that feels somewhat normal. Normal for you may feel different for me. Normal for me may feel different for you, but we are all in this together, and we are happy to help. If you're looking to set up a new program, we have a lot of resources that we can help guide you. So I'll leave it open for any questions or comments that hopefully I can answer.
Thank you, Kimberly. That was a wonderful presentation. And we do have a question. As I mentioned, if you all have any questions, please use the question box and we'll read those now. Our first question is, what is the cost for one of those Tidal devices?
So these vary across. It really depends on how many you would purchase at any given time. We purchase ours through our digital health team. So I would say, probably around maybe a $2,000 to $3,000. But again, a lot of that's network connectivity, the type of device you want. Some sell at Best Buy or commercial retailers for as little as $150 or $200. But it really depends on what how you want to build a virtual health or your Tyto care. It is affordable for most people and who have commercial insurance or even a self-pay. But if you would like to do it enterprise level throughout your system, those costs definitely vary. If you're interested, I'd be happy to connect with you offline.
Thank you, Kimberly. Please let us know if you're interested in connecting with Kimberly offline. We have her contact information displayed on the screen, but also I can be of making that connection as well, just in case you are calling in and unable to see the screen. Another question, were there any challenges to the enrollment process, and how was that? How did you all overcome that?
That's a great question. So we did have challenges with enrollment, as you would imagine, when students aren't coming to school on that first day because of most of the schools are virtual. That did make for a lot of challenge to try to get that out. But our nurses, again, that nurse communication and the district communication, they were very supportive. And we did not mail them as we normally may have in the past, but we provided them to our schools and they were put into welcome packets for all of the parents. So we were able to get them into the hands of students and families. And then when they started coming back into the schools, that's when we noticed that the paperwork also started coming in. So they trickle along, and there's nurses that will call me and say, I've got 25 consent forms and we're already in the middle of the year. So they don't all come back at the beginning. But again, it's that connection and communication and that relationship that we're building with the nurses. And we don't have the consent forms available online yet. That is one thing that we are looking to, we're exploring, because that would certainly eliminate some challenges in terms of getting that paper form back, because right now that's the only option we have.
Right. Okay, we have two more questions that came in. Which schools do you partner with, and how do you determine the partnerships?
So I'll start with how we determine the partnerships. When we're focusing on the partnerships, we're looking at a lot of these rural areas. So for example, in Lexington 4, we partner with the Freshman Academy in Swansea, and that is considered a rural area for us and where we can really have the most impact. That doesn't mean that we don't look at schools within urban areas, because as we all know, that there are a lot of urban areas that have either high unemployment, a poverty level. They don't have a lot of healthy food access nearby. Sometimes the convenience store or the Dollar Generals are where people go to shop for their food. So we are aware that that exists in urban areas. That's why we partner with several schools within Richland 1 that are considered urban. So the schools that we're in that are rural, we consider are in Pelion, which is in our Lexington 1 school district, Swansea, which is in Lexington 4, and also within Richland 1, our Hopkins, Gadsden, Eastover, Lower Richland County areas, because as you guys know, Richland has a very wide footprint, and those Lower Richland areas sometimes are 45 minutes away from the nearest healthcare facility. So again, the focus is always rural, but it's not just that. It's really where can we increase access to care, whether it's rural or urban.
Awesome. We have another question, a little change. With the increased focus of behavioral health needs for our students, what type of therapy or psychiatry services do your programs provide? And are these Prisma employed psychiatrists or social workers delivering care?
Another great question. I will probably need to answer that offline because we have in our Greenville County, I know that the virtual health and telehealth programs and the in-person care that we're providing through Prisma Health does focus on behavioral health with our students. I don't have as much information about that. So whoever asked that question, if you would reach out to me offline, I would be happy to connect you with our providers in the upstate. Because they do provide that behavioral care. Right now in the Midlands, we have a program that's kind of outside of our quote virtual health telehealth program, but we do have an area of, we call it our community connections program, where they actually embed themselves, and it is a licensed social worker who goes in and helps out with one of the schools in an urban area, but a high poverty, high unemployment area. And they do provide social and emotional learning and help out with the social determinants of health, connecting them to the resources, families to the resources that are needed. So that's a great program, a great impact. That is currently one school in the neighborhoods around there. We would love to do more. And as we begin to develop resources and planning, we do want to shift into somewhat of a behavioral health care option for our students, because we do know that is very prevalent, and not just with students, with families as well.
Yes, 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 yes. All right. Well, looks like we have one more question. How do you market this service to students and parents, faculty, and staff? How do you build the relationship with the school nurses without them feeling like their job is not being taken if you have a telepresenter on site?
Great question. So I'll start with the marketing of this. It really is, it comes down to, the consent form. We put a flyer on there, and we get that in the hands of all of our students in the schools that we're in. The district also is a big supporter of us, sending out emails, getting information to parents. And then just through some of the success stories that we've had through the years, we've put that either in a press release or sent it out, done an article on it. So we try a lot of ways to really find those success stories. And when you can see somebody benefiting from this, that creates a higher awareness. So we do work closely with our marketing communications team to tell that story. And we know that there's even more out there that we aren't telling. It's just finding those success stories. And then in terms of the communication with nurses, that really is what it is. We try to email and talk to nurses and visit them as we can, and let them know that we're here. A lot of times when we go out, we'll share, we'll provide them with some jump ropes or some things that we have here on hand, maybe some PCP or some alcohol wipes, or whatever the case may be. We want to know that we support our nurses, that we support our teachers. And our partnership with Go Noodle also helps with that. Go Noodle is a great partner with our schools, and allow those teachers to feel like they've got an extra level of support if they need a brain break, need an activity break, need a mindfulness break. That's where something like a Go Noodle definitely helps out and lets our teachers and administrators know that we're here for them.
Right. So it's more as a add-on or a supplement rather than, a replacement of the nurse.
Right. And we do, the nurses, when if we have a telepresenter, that telepresenter really is there to help. And that is the key message, that this is not an added something that nurses have to do. And once the nurses see what a benefit this is, I've had many of them come back to me and say, at first I thought, oh, this is just something else I have to do. but when I see how it benefits these students because they don't have primary care providers, or these students are going to, you know, CVS, a Minute Clinic to get primary care services, and that's not what that is there for. When we can help them in the schools where they're at every day, and then provide them a connection to a primary care provider, a family doctor, that's a great benefit. And I've had many nurses say, this isn't just an extra thing for me to do. This is something that we need to do.
Yes. Well, thank you, Kimberly, for answering our questions. I'll give you all just a few more seconds in case there's a last minute question, but as Kimberly has mentioned that she is welcome to and open to answering questions offline. She has shared her contact information. If you did not join at the beginning, this webinar is being recorded, and both the presentation slides and the webinar recording will be available for you all to review and share with anyone who you think may be interested. Thank you all again for joining Webinar Wednesday. We hope to see you again next month. Kimberly, are there any last minute comments that you would like to add?
No, thank you for this opportunity, and please don't hesitate to call or email me, connect with Davia, and she can reach out to me. We're happy to help advise or do any consult on developing these type of programs. It definitely takes a village, and we have a big village here at Prisma Health, and team members who want to help increase access to care, which is our overall goal.
Well, thank you all again. Thank you, Kimberly. That was an excellent presentation, and you all have a wonderful afternoon.
Thank you.